My name is James Berry. I'm head of policy research and development at Coram Bath, and I'm joined by
I'm Elinda Briheim-Crookall. I'm head of policy and practice development at Coram Voice.
Brilliant. And today we're going to have a conversation about some of the research that Coram Voice have been doing. And I suppose, Linda, we sort of talked about it. It's just what are the sort of key things that? Well, can you tell us a bit about the research and the background?
So what we're talking about is the Bright Spots programme, which is a research partnership that was developed together with Professor Julie Selwyn at the University of Oxford and funded by the Hadley Trust. So we've been working for over 10 years to capture what children and young people in care and care leavers feel about their well-being, and focusing very much on the things that they feel are important to their lives. So through that, we've developed 4 well-being surveys, 3 that are for children in care, so from age 4 up to 18, slightly different depending on the age group, and 1 for care leavers.
Okay. And just in terms of today, is there anything that particularly you are going to focus on as well?
Yes, I thought I'd tell you a little bit about the findings overall, some of the things that we've learned through that project, but in particular, what we thought would be speaking a little bit about the experience of older young people in care and some of the differences between younger and older children in care, and some of the challenges that they may face as they're sort of 16, 17 and coming up to the point of aging out of care.
And just like and thinking about that, what are some, I suppose, what are some of those challenges that you've identified through the research?
So I think overarching, I mean, if you just kind of step back and think about the research as a whole, there's some really positive things in the finding. We focus on well-being. We developed our well-being indicators together with children in care and care leavers themselves to capture the things that they said made their lives good. And there's some things like 83% of young people in care say that their life is getting better, and some positives in terms of a higher proportion of children in care, like school, feel that they're supported in education by the people that they live with. And in general, kind of some real positives, but there's also kind of challenges that children in care have compared to the general population. So there are things around a lower proportion having a good friend, things around stigma and experience. There's a great proportion that report worrying about their feelings and behavior. And I think some of those things particularly stand out when you're getting to the older age group.
And do you see a definite change in the findings as you get
Yeah, yes, I'd say so. I mean, we do ask slightly different questions from the younger children and the older children because of, understanding and the kind of the types of things that you can ask about, and how long you can ask a child over 5 compared to a 16-year-old to sit and complete a survey. But I think when you're talking about 4 to 10-year-olds, that it's very much about the focus on carers and their sort of the feelings in with them, that bullying is a kind of important issue and stands out as a challenge for that age group. And they talk about having fun at weekends and also about understanding the reasons why they're in care, it being a kind of real challenge for the younger children. Whereas when you go into the older age groups, they're developing their independence and they have more input into decision making. So if they're being involved in decisions is comes to the fore and becomes much more important. And they talk a lot about kind of having worries about their feelings and behaviors. And we don't, it's not a mental health survey, so we don't explore the kind of details of those kind of things, although other research has shown that children in care have a higher prevalence of mental health challenges, but certainly like the young people themselves describe themselves as having worries and challenges. And I think particularly the kind of things that stand out for girls is around not being happy with the way you look. And then also, you know, friendships become really important as you grow older. They become like the kind of key people in your life. So having opportunities to do the similar things to friends is something that the older age group talk about. But of course, you know, across the board, trusting and supportive relationships with both workers and carers is important for all children in care. Feeling safe and settled where you live is important for all children in care. Liking school, being able to see extended family and important networks and good friends is important for all children.
And I suppose I think like when I read the research, I think one of the things that I really love the research because it brings, I suppose it brings children who you might be working with as a social worker sort of to life, and it's sort of thinking about actually what do they care about and what is really important to them, rather than necessarily when I've sort of filled in, say, forms in the past, or completed assessments, and you're looking at things like education. You're not necessarily always thinking about what does this children actually like? Does this child like school? You're thinking about what's their attainment sometimes. And I think what I found really sort of wonderful about the research is it helps bring some of that back and actually that child's experience. And I've found it really helpful. You've got some amazing diagrams, haven't you, which sort of bring that to life as well, which I've been
absolutely. And I think that's been a really important thing about the Bright Spots program, is all about putting the kind of experience of children into practice. So we work with individual local authorities. We've worked with over 80 across England, Scotland and Wales, and captured over 24,000 voices for the last sort of 10 years or so. And that thing about practitioners, decision makers, team managers kind of listening to children and doing something about it. And I think one of the things that the program has done in a lot of places is kind of changing the dialogue a little bit, focusing on different things. So as part of our indicators, for example, there are things about pets that, young people said pets are really important for us. They're the ones that love us unconditionally, that we have opportunities to care for ourselves, that we can talk to without kind of repercussions. Or young people talked about access to the internet, which is, maybe not a focus for services, but actually for them, it's about being connected with their wider networks. And for some children, they might not have that access for a period of time because of safeguarding concerns, and that really impacts on their relationships, and they find that a real challenge. So I think it has meant that you focus on slightly different things and start slightly different conversations. And a really important thing about the program is about how do you then kind of respond to the things that the young people say? And we always encourage all the local authorities that we work with to try a sort of co-production approach to that. So listen to their young people, but then kind of take that forward in conversation with young people to say, well, what should we be doing as a result of this? And I really love some of the more sort of innovative examples of what people have done. So on the pets front, for example, in Oxfordshire, they had an ambassador for pets that took her dog around the kind of children's homes and sort of championed pets, so that IROs thought about it more and those kind of things. And in Stockport, their care leaving service really focused on pets. So they had a pet food bank, and they thought about how they could support and work with a kind of charity called Blue Cross around kind of training young people and caring for their pets and all the different things that they needed. So there's lots of ways of like kind of refocusing the conversation, I think, through the program.
And I think it's about bringing it back to those sort of real things that young people sort of might feel they need or feel they really want in their life, which would make a difference to them. And those examples you give are sort of really practical and sort of powerful about things that could make a difference to a young person in care. Just sort of going back to the findings, was there anything that sort of surprised you in the it's a substantial piece of research, and I suppose you'd been keeping up with it, but was anything as it came sort of towards its conclusion, was there anything that sort of like surprised you or was a bit sort of counterfactual or something like that?
So I think the fact that there are positive messages about care, that there's some, there are areas where children in care do better than others, I think, is something that stands out from this work. I think that focus on different topics and different experiences, the things that we haven't, I don't think services have focused on, how children feel about the way that they look, for example. And we had one authority in Sheffield where, as a response to what their children said about that, organised a fashion show together with their young people to kind of celebrate different bodies and different looks, and sort of those kind of positive things that I think have not necessarily surprising, but kind of put you in a different frame of mind. I think some of the things more about what it's reinforced that we didn't necessarily have evidence for before, but now it's more sort of black and white. So one of the things that really stands out in the findings is also that different groups of children in care have different experiences, and we need to sort of be mindful of that. So there's differences between girls and boys reporting different levels of well-being, especially around how you look, but also kind of overarching low well-being is more common among girls, but also placement type really matters. So children living in family-based care, so foster care and kinship foster care, have more positive experiences than children in residential care and supported accommodation, and that difference really stands out. So things like compared to children in foster care and kinship care, where like 8% and 5% report not having a trusted adult, in residential care is 14%, and in supported accommodation it's 18%. So like almost 1 in 5 don't have a trusted adult in their life. Not feeling safe where they live is a higher proportion in those other kinds of accommodation. Not trusting the people that they live with is comes up to 43% of the children in residential care, and we have a category that is other somewhere else, but it's essentially mostly supported accommodation, a few of that kind of hospital or a prison, but mostly kind of supported accommodation. So it really, I think that's really stark and really tells us something about the kind of level of the challenges that those young people face.
And I know that's sort of when we sort of were talking about this sort of conversation, that was an area I thought you wanted to bring sort of forward and bring to the forefront. So I mean that statistic you said about sort of, I think there was it around 40%?
Yeah, so
that? What was that one?
So in supported accommodation, 43% don't always trust the adults that they live with, and I think what we've been doing some work on a kind of policy level. There's the Department for Education have been introducing standards for supported accommodation, and Ofsted is going to be inspecting those settings. And whilst we sort of really welcomed some of the language of those that framework, they're focused more on some of the things that we focus in the Bright Spots program, like trusting relationships and feeling safe and young people's voice. We're really concerned about creating regulations that specifies that it's okay that some looked after children don't need care, and how children are children until they're 18, and there's the kind of what our findings I think suggest is that they experience real challenges, and that we really need to think about how we support them.
Absolutely, and I think it's been a area of quite strong contention in the sector, hasn't it? Around this. I suppose just from the research, is there anything else from 16 and 17-year-olds that sort of comes through around that would sort of help sort of people who are listening to today, sort of when thinking about those children in care?
Well, I think both from our research and our sort of wider participation work, I had a conversation with our participation manager recently, who was emphasizing how young people, when they get to that 16, 17 age, they really start seeing the difference between themselves and peers, because they're potentially not living with in a family-based environment anymore, whereas the others live with their mum and dad who like take a great interest in their education and provide them ongoing support. And then suddenly at like 16, 17, they're having all of this conversation about soon you're going to be on your own, you're going to need to be independent, you're going to need to learn all these skills, and there's quite a lot of pressure on that age group, I think, to kind of really get yourself prepared for that, and that can be really scary. I remember seeing a comment in one of our surveys from a young person who said, you know, we talked about homelessness in school, and they said that care leavers are much more likely to be homeless than other young people, and that made me really scared about what's going to happen when I turn 18. Like, will I end up homeless myself? So I think it's those kind of challenges, and potentially having to kind of move on to benefits or move up on your own and manage everything independently. So I think those are real challenges for that age group, and something to think about.
And just thinking about the 16 and 17-year-olds and sort of 16 and 17-year-olds in care in general, what were the biggest things for them in terms of lots of factors in their well-being, you know, according to the research? What were sort of some of the general points that sort of came up?
So I mean, we haven't done an analysis by every single kind of age group. So I think that the thing that you can mostly see is that difference between placement type and knowing that 16, 17-year-olds are more likely to be in supported accommodation or residential care, and there you can see the strong differences. We also have done analysis that compares kind of the teenagers, so 11 plus secondary school age, to the younger children. And I think in both of those things is about the kind of that movement into independence, that they are more likely to be able to practice life skills. They do have a more involvement in their care as they get older. We do see that, but they also talk about sort of not being able to do the same things as their friends. That might be because of resources, because they can't access the internet or have a mobile phone to communicate with their friends. They also you know, friendships are really important, so we get lots of people commenting on the kind of challenges around friendships. When we ask slightly different questions for care leavers, and you know, care leavers, we ask who are the people that provide you with emotional support, and the number one group there are friends. So you're really laying the foundations for kind of future networks of support as young people are in that age group, and the kind of things that happen, whether you get cut off. And one of the things about kind of comments around supported accommodation have been things like, I've been placed really far away from my college and my friends, and I can't afford the transport, or it's really hard to get there, so I can't see them. I feel, you know, that makes me feel lonely and isolated. I need people to talk to. Those kind of things are the kind of things that get brought up by that age group.
And I think, you know, and aside from the sort of fundamental sort of principles around sort of, you know, children in care and receiving care or receiving support, it's that sort of the idea around independence, isn't it? There's that sort of and how independent, say, a 16 and 17-year-old can be, and it must be quite, you know, it must be incredibly daunting to have to try and sort a lot of those things out yourself with, say, less support. And I just wonder if any of that came through.
Yeah, absolutely. And I think, you know, the for children who aren't in care, their parents do a lot of things for them and really support them in a whole host of different ways to kind of navigate the kind of paths into adulthood. And I think you see that amongst children in care as well. When you kind of look into care leavers' experience, actually the second most important group for them in terms of emotional support are their personal advisors. And there's some really positive messages around personal advisors. So kind of the professional framework can also provide them with practical support, but also that emotional kind of network that we get lots of comments from young people who, like, you know, they're always there for me. I can always kind of reach out to them, and they will help me when I'm in challenge. So I think that's the other thing to think about with the kind of 16, 17-year-olds, of like both trying to provide as much of that parental type support as possible, and whilst also recognizing that, you know, they are moving into independence. You need to kind of enable them to do things and broaden their networks. And I suppose that there's been debates around whether you're preparing people for independence or for interdependence. So there's something about also like, how do we really support those wider networks and linking people in? And I know that the government have launched a new fund around creating initiatives that can help family finding and reconnecting with important people and befriendings. And I think, you know, those kind of things are really important, that age of like, are you thinking about who's going to be that for that child when they're 30? And can we link them in with those people and really put some effort and resources into that?
Absolutely. It's and it is, yeah, that's really interesting, that research around the support from that care leavers perceive as who are the most important people for them when they have left care. I was just wondering, is there anything, sort of having thought about that, the research, particularly around 16 and 17-year-olds, is there anything that, you know, from your research that you thought that professionals could do more to support those young people?
Yeah, so one of the things I would encourage people to have a look at is on our website, we have a resource bank where we try to capture some of the case studies and examples of things that local authorities have done in response to their findings. So some of those things are things like both in the Isle of Wight and in Wandsworth, the young people got involved in commissioning of supported accommodation and kind of helped inform what it was that they looked at and looked for in accommodation providers to kind of more meet the needs of young people. So one of the things that kind of stood out in Wandsworth that became a different focus was they were really keen on staff training and continuity of staff, because what young people said is like, when I come back on a Saturday a bit worse for wear, I want to be met by someone who isn't just an agency worker but who knows me and who knows kind of how to support me in that situation. So like that was influential there. And I think also kind of initiatives that could bring people together, a very simple one that was from early stages of our research is Isle of Wight's established this Come Dine With Me program, which just brought together care leavers. It was an element of kind of preparation for independent living, in the sense that they got together, cooked a meal together, got the ingredients, some of it from their allotment and all sorts of things, but also that sense of community that brought, that you had that time in the week where you were coming together, you were seeing each other, you were building your networks, and also, you know, doing something communal together. So I think those kind of things are really positive, kind of providing opportunities for young people to build their relationships and
it's really interesting. It's sort of that the finding. So sort of like one aspect is that sort of co-design, which is fundamentally listening to young people and then sort of like working with them alongside them to actually produce something which is for them and works for them. And the other thing is just about this relationships, which actually, when you look at a lot of research around sort of well-being in general, relationships, you know, it seems really obvious, but it's about relationships and sort of encouraging people to have good relationships or fostering good relationships.
And that's a key thing, you know, between workers and young people. You know, take the time to listen to them, understand what makes their lives good. Developing those trusting relationships, you know, that's a core message from the Bright Spots program in terms of how important that is, being able to get hold of your worker, knowing that, you know, you can talk to them on their own, and you know, if you have challenges, like, who do you turn to, those kind of things. And I think also around when you're having those conversations, you can find kind of individual solutions to particular situations. You might not be able to change where a young person lives, but there may be things that you could do to make them feel safer in that situation. Again, on the kind of care leaver example, but sort of linked to especially kind of the 16, 17-year-olds who might be moving into independent living in Stockport, one of the things that they were really concerned about was the number of care leavers who reported that they didn't feel safe where they live. And they had conversations about like, how can we address this? And one of the things that they suggested was, can we have a ring doorbell, you know, one of those doorbells where you can see who's at your door, and choose to let them in or not. And that was introduced and like made a lot of the young people feel much safer where they lived, and kind of they're more in control of the setting. So sometimes you may not be able to change everything, but a small investment can kind of improve things for individual young people.
Yeah, and I suppose sort of like linking into that sort of relationships, how did Bright Spots, you know, in terms of developing relationships with young people to actually be able to respond to the survey, how did that work in practice, and was there any feedback from young people about engaging with the Bright Spots program?
So it's very much driven, like the way that the Bright Spots program works is that it works on a local basis. So we facilitate local authorities to engage with their young people. Obviously, when we first developed the surveys, then we worked directly with young people, and we had focus groups and sessions and workshops to kind of think about what are the things that are important to you, how are we going to like best capture things. But it's really at that local level that the local authorities are asking their own children how they feel about their lives, and then they do kind of invest in responding and developing initiatives that work for them, so that there is that. I think one of the things that young people really said when we were developing the survey is, don't ask us questions if you're not going to do anything about it, because we're not, you know, so that is a really important part of it. And then it's been a sort of bonus almost for us that because we've done it in so many different places and with so many different local authorities, we get this national picture of what the experiences are like and what they have. And I think the best, you know, the most positive feedback, and I think this seems to work best for young people, is where you then have the kind of co-production approach to developing the solutions to it, and when they can see those things happening, that is really empowering. We had a more involved project called New Belongings, which was about sort of trying to embed that co-production approach and using our surveys to explore the experiences of care leavers. And I think from what young people said about their experiences of that was, it was very much one, understanding how decisions are made and how they can influence things, and when you feel heard, it just kind of shifts your perception of yourself, your perception of what you can achieve and where you can go. So there's just the kind of co-production process in itself gives young people so much, so you know, we definitely sort of champion that across.
And I fully appreciate that about Bright Spots. That's really interesting. So you sort of enable, by conducting a survey, you sort of enabling these local conversations to occur with a sort of a view to them sort of changing practice on the ground, which is, yeah, that's hugely powerful.
And we definitely say that, you know, if Bright Spots program was the only way that you heard from young people, I would be really worried, because, you know, it's a snapshot. It tells the benefit of it is that you do it at one point in time, you can potentially reach a much larger number of your young people than, say, a children in care councils work with 10-20 young people. The surveys, you know, reads hundreds of young people in an individual local authority, and really gives the kind of overarching perspective. Some of our authorities have had like 80% response rates, so that gives you like a really a good snapshot. But it's a survey, so there's only, you know, we do have qualitative things, people do get quotes and things, but you really need to sort of dig into some of the particular experiences to think about how you can respond to that. So we want it to be complemented by other ways of listening to young people. And I think another thing that's been really positive is where local authorities have used some of the types of questions or some of the themes and kind of embedded them in practice. So focusing more around like friendships in the individual care planning or personal education plans and those kind of things, talking about bullying, in school, or you know, so thinking about some of the things that we focus on, but embedding it across the different areas of work.
And just thinking about sort of bright spots, sort of from now, what's the sort of next steps with bright spots? What you've obviously published these reports, you've produced these really powerful findings. What's happening now?
So it's an ongoing program. Local authorities can approach us. We work with local authorities, about 15, 20 different local authorities every year. And certainly would encourage anyone who's interested to get in touch with the team and explore that. We also are looking at the moment just about how our latest research report was over 100 pages. I don't expect most people to sit down and read that cover to cover, but how can we share the messages from that with our audiences, or with particular or focusing on a particular theme? So we've done some work. Last year we produced a report called Staying Connected, which was looking at the sort of particulars of how children and young people feel about connection with family and the people who are important to them. And we're doing a small pilot with 3 local authorities around how can we sort of explore that particular topic in more detail, and how can they develop some action plans to respond to what their young people say about staying connected, and some interesting things around kind of focusing on particular groups of young people, like children in residential care, and also around kind of particular areas of work, so like contact with siblings, for example. And then we're also doing some work this year around some messages for schools, and delving a little bit more deeply into the experience of care leavers with disability.
So yeah, it's a lot that you're covering, but that all sounds really, really fascinating, and sort of look forward to hearing more as that comes out. I suppose we're sort of coming towards the end. Is there any sort of like final thoughts, or sort of like concluding thoughts, or anything you'd want a listener to sort of go away with, sort of thinking about the research that you've produced, or anything we've talked about today?
Well, I think the overarching message from the program, the sort of approach that we come from, is that children and young people are experts in their own lives, and there are really important in terms of thinking about how you design the care, how you support them. So, I would encourage all practitioners to take the time to listen to children and young people about the things that make their lives good, asking them about their relationships, about their friendships, where they live, and explore together the things that would help them make sure that they feel safe and settled where they live, and that they have those trusting and supportive relationships in their lives.
Brilliant. And just to add to that, I would just encourage any practitioner just to have a look at the summary, because I think within that you just get the key messages. You get to see just some really interesting things themes that young people say are important to them. And I think most practitioners would look at that, and I think it might change bits of their practice, or things that they might choose to say or think about young people. So that's the other thing. So have a look at the summary. You'll get something from it. But yeah, that's great, Linda. I think that's it for now. But it's been really fascinating listening to you. I've learned I've sort of some of the statistics you said about 16 and 17-year-olds I hadn't fully appreciated about the difference in placements. I think that is really useful. I'm going to go away and have a look at those again, or look at them fresh, really. So that's something that I will be looking at. But yeah, thank you so much.
Thank you so much for having me. It's been a really useful conversation.
Brilliant. Thanks a lot.